Hello, welcome to another episode of Fulbrighters for Disability Inclusion. I'm your host, Samar Naqvi, and today we have with us Qazi Fazli Azeem, who is a Fulbright alumnus and the first Pakistani self-advocate for the autism spectrum of disorders. Fazli completed his MFA degree from Dynamic Media Institute, Massachusetts College of Art and Design, and currently works as an assistant professor and program manager at the Media Sciences Department at Zabist University in Karachi. He has been representing South Asia and Pakistan at multiple conferences and has co-authored a book, Been There, Done That, Try This, on educating young adults on the autism spectrum. Fazli, thank you for being here with us. Welcome, and it is such a pleasure to have you here.
Thank you for inviting me.
So for starters, could you please speak a little bit about and enlighten us on what it means to be on the autism spectrum of disorders and everything and anything that we need to know to educate ourselves on it.
Right, I'll try to summarize because I'm not a medical doctor. So autism spectrum disorders is a developmental disorder. It's not a disease. That means that it's a lifelong condition, and it's usually diagnosed when the child is young, what we know as early intervention. And if the child obviously is given support, accommodation, therapies, and educational support, and helped along with their condition, they can go on to live independent, successful lives on their own and be a fully functioning, productive member of society. Uh, Unfortunately, that doesn't happen as often, in our part of the world because of misdiagnosis, wrong diagnosis, or non-diagnosis, and so on. But I'll talk more about the condition before I go forward. So autism is basically primarily sensory overload issues are there. It's a communication disorder. And there's no medical test as such for it, so you can't have, like, say, a test, or a brain scan or an MRI. That doesn't work. It's a behavioral disorder. So if the child is behaving differently, if the child has problems such as delayed speech, if the child has problems such as lack of eye contact when communicating with the parent or with the strangers, if the child has issues regarding problems in vocalizing or being unable to, let's say what they're feeling, understand emotions, responding inappropriately to communication, or even having problems in how they behave. So having obsessions with certain subjects, or let's say, behaving physically, visually different compared to other children, as in hand flapping, or perhaps staying away from loud sounds or loud noise or bright light because of the sensory overload issues. But so there are a lot of symptoms. Every child on the autism spectrum is different and unique, and no two children are exactly the same. That's why the symbol of the puzzle is usually used when denoting autism awareness around the world. And keep in mind that a child on the autism spectrum will grow up to be an adult on the autism spectrum, right? It's a lifelong condition. And as a consequence, it's usually better for the parents and the child and society if such children are identified at a very young age, ideally during their schooling, or when, by a pediatrician or by a child doctor or by a psychologist. Obviously, we don't have that many child doctors, pediatricians, psychologists in Pakistan as we should. The numbers are very few. But teachers should be aware, special educators should be aware, and especially parents should be aware about what the signs are possibly, and how to kind of recommend their child for a diagnosis, or for support, or for therapy. Obviously, everything comes after the diagnosis, right? So these are some sort of symptoms, as I mentioned, of the autism spectrum.
All right, great. And I mean, that explains it. Also, if you could talk a little bit about your own experience being on the spectrum yourself,
Right.
what has it been like growing up? How challenging it was at the beginning? Because I do understand you're a self-advocate, and how'd you go around the process of diagnosing at that point in time?
Right. I was diagnosed at a later stage, around I was 25 years old. This is called late diagnosis. And I would come under the so-called diagnostic criteria, perhaps of higher functioning autism, what is more commonly known in the past as Asperger's syndrome. Based on the researcher Hans Asperger who discovered it. I had echolalia when I was young. That means that I couldn't understand speech. So when somebody used to say something to me, I used to repeat it back to them. So basically, my language was completely visual. Let's say this A equals B, right? So for example, if I wanted water and somebody comes up to me and asks me the question, do you want water? I assume that that statement represents me wanting water. So I used to go around to other people and say to them, do you want water? When in reality, I wanted water. But that entire statement A equals B, right? So it's a very different way of understanding language. It's called echolalia, when you repeat whatever someone's saying back to you, back to them, because you don't understand speech from the understanding point of view, right? It's completely visual and object-based. Also, I had lack of eye contact with strangers for a very long time, till I think about till I was 14 or 15 years old. I couldn't look people in the eyes when I was talking to them, especially people I didn't know. Even with my relatives and so on, it was very hard for me to maintain eye contact, and that obviously causes all kinds of problems. And people kind of think you're trying to hide something from them, or it's strange. It's a strange behavior when you're usually not making eye contact. So that was always, it took me time to overcome that through self-training and looking at my own eyes in the mirror and kind of sort of helping myself get used to that process basically. Other than that, I've always had sensitivity to loud sounds, to certain kinds of sounds like children crying. That's very painful and for the ears, or repeating sounds like a fan is kind of sort of going on, because they have the static sound that comes after machines and televisions and tube lights and other things. So those kind of sounds kind of irritate me generally. And then you have certain kind of lights like the yellow light generally is very kind of distracting. So I'm able to concentrate more under white lights or other tube lights, that kind of light. Other than that, there are sensory overload issues. For example, the skin is very sensitive. So if there was like a shirt with a tag connected to it, it's very painful and kind of. So I didn't have the words to explain this when I was young. My parents used to chase me around to take me to the barber shop when I was young, because I actually couldn't explain to them that the steel sort of scissors of the barbers, when it touches your skin, it kind of feels weird, right? I didn't have the words to understand or explain, even though these issues were always there, right? And they kind of got better over time. I kind of controlled them and learned about them. But till I actually found out about my own diagnosis again later on at the age 25, until then, I didn't have the words to communicate what I go through. And I found out for the first time that I'm not alone. There are other people like me around the world. There've always been people like me around the world, and they are called self-advocates. They talk and they write about these things and how they overcame them. And normally, most of these self-advocates are not young. Majority are very old. So the whole concept of self-advocate for the autism spectrum, it started probably with Dr. Temple Grandin. She's a very senior sort of professor at University of Colorado Boulder, and she's one of the world's leading authorities in certain subjects, including how to manage cows and so on in the US industry. But so her probably becoming a self-advocate perhaps around 25 to 30 years ago, that's probably what started the whole concept of other self-advocates coming forward. And obviously me reading their books later on when I got diagnosed, and then choosing intentionally to be a voice for people in this part of the world where I didn't find anyone else, right? So
yeah, that's so interesting, Fazli. And I do remember when you and I got acquainted a few years ago, you were mentioning an article about how they studied some of the traits of the geniuses in the world who were gifted individuals. And back then, when the autism spectrum of disorders wasn't a term, And now when they read about those, it kind of alludes to the fact that perhaps some of the geniuses may have been on the autism spectrum disorder themselves. Um, it's just so fascinating because it's another way to look at disability altogether. Um, and, uh, and you were talking a little bit about the work that you've been doing. Could you also, for the audiences watching, talk about what you're doing here currently and what all you have accomplished so far ever since you came back? I'm sure prior to you leaving for your degree program as well in the US, what all have you been working on besides being a self-advocate for the autism spectrum disorders?
So I'm assuming you're referring to professional work, right? Not the
Yes.
non-profit work that I've been doing. Okay, right. So professionally, since I came back, I was a graphic designer and I was teaching design at the Indus Valley School before I went to my Fulbright. And then when I came back with a master's degree, this automatically allowed me to continue in the field of higher education. And I chose to slightly differentiate my prior sort of practice and work from my current work. In that, I learned about things like universal design. I learned about accommodations and inclusion in higher education, where they intersected with my interest in graphic design and visual communication design and interaction design, and certain subjects that I was not aware of, in Pakistan. So though the awareness of those subjects led to my sort of role in creating a curriculum for inclusive people here in the country, allowing greater levels of inclusion and visual training, because a lot of things that happen because people who have these specific or specialized learning so-called disabilities, in a way, they are in a way extreme learners. They learn in a particular format, in a particular way, and that way obviously doesn't apply to the neurotypical or the generalized public, right? So when you kind of create strategies for them, they actually work better sometimes for the generalized student who is unable to function or learn well, or the so-called neurotypical student, because having a particular specialized way of teaching or certain techniques and certain strategies, they actually work better in some cases. So this level of inclusion has led to greater interest in my classes as compared to before. Now students are definitely more interested. They have different ways of engaging with the content. They have different ways of expressing their visual and artistic and creative abilities. And obviously, we're all visual learners generally, right? I mean, unless you have some kind of impairment visually, most people learn faster visually. And in the field of visual communication design or graphic design or other related areas, such as user experience and now product management, all of these areas rely very heavily upon different strategies that I learned abroad, like simplifying things, making it completely visual, having less text on the slides when I'm presenting something. These are all strategies that were used literally every day during my graduate education in the US. I learned these techniques. I learned how self-advocates communicate better visually and using different strategies. And I included them in my curriculum design, my courses, in all of the courses I teach. I use the different pedagogies, different visual strategies, different ways of accommodating students and allowing them the freedom to choose between the method of sort of recording or creating the content and submitting assignments in the way they generally would prefer. So one student could write it, another student could use the computer and type it down. A third student, for example, could record their voice. It's all a form of documentation and submitting it. So accommodations allow students to actually engage in content and create their assignments and solutions in a more universalized way. And that sort of universal design, this UDL, universal design for learning, this system should actually, it is being used abroad. Generally, it applies to pretty much everyone, allows students to learn better. I incorporated that into my teaching. Yeah.
Interesting. And I mean, like that just also brings me to the question as to how you got into teaching. Because I assumed that when you came back, there were multiple options for you to kind of get to know of or like learn and then get into a certain type of sector. But why teaching? How did you get into this?
Well, before I applied for Fulbright, I was a full-time educator already at a university at the Indus Valley School. at their communication design department. And it's an HEC requirement for you to have a master's degree if you want to continue teaching, particularly if you want to teach at the graduate or the master's level. It's a requirement, right? So that was obviously a push towards that. As far as why I became a teacher per se, generally, growing up, I've always heard stories. My grandfathers, both of them, and their ancestors, great grandfathers, and so on, they were all teachers. Essentially, they were connected in pre-partition in British India. They were educating people, and I always grew up with stories of them. And I kind of saw them as role models because they were contributing their bit to society, trying to make a difference in their own manner. And my own father, like, he used to say to me that this entire sort of generation, his generation of people and all my family, no one chose to become a teacher like their ancestors did and the people before them, right? So I kind of wanted to kind of continue that legacy in some way by obviously doing the industry work that I do, the graphic design work I do, but also contributing my bit to the country by educating the future and the current generations of design professionals in the country.
Right. Wonderful. Wonderful. And you're very open to that too. Just prior to this conversation, we were also speaking about you offering some editing courses to me as well. Firstly, I know you mentioned earlier too that you had to undergo a process of self-training and kind of learning to kind of navigate the space that was around you, what was given to you, learning from different sources. It's fantastic that you have that skill and ability to learn. But also, I imagine that it must not have been an easy process to try to configure, pull from different sources, and being so lost at one point in time where you're trying to say something, but you're not able to express or communicate the way that people understand generally. So if you could speak a little bit about what that process was like.
Right. So I've taught a lot of students in the last 15 years or so, and some of them come under the so-called category of dyslexia, where they have problems in reading and it's not easy for them to read. Obviously, then they need some kind of support or help with the reading of text. In my case, it was the opposite. I have something called hyperlexia. I'm able to read very fast, but on my own. So when I'm not disturbed, when no one's, because in a classroom environment, you see when the period ends and the next sort of class begins, there's a loud bell that kind of rings, and it was very distracting to me, as an example, right? In the same way, all of the students getting up and all the hustle bustle, noise, the randomness, these are all structural systems where transitioning from one class to the other, it was very distracting, right? And talking to people, eye contact. So the entire school environment generally is not inclusive for people who are neurodiverse or on the autism spectrum, right? They need certain therapy, they need awareness, they need advocacy, they need an area to kind of calm down their sensory overload issues and work with them. So it was a non-inclusive environment. So basically, I used to come home, and then because I liked what I was seeing visually, all the books had pictures, and I like the cartoon sort of comic drawings and things in those textbooks. I used to teach myself again whatever I used to, I kind of had ignored in class because I was just unable to concentrate in that environment. So in a home, it was a more quiet kind of inclusive environment. So that was there. As far as my being able to function or rather teach myself, I think it also has to do with the spectrum, the autism spectrum. Generally, a lot of people on the spectrum, they don't have interest, they have obsessions. So they're obsessed with certain subjects. So my obsessions, for example, were dinosaurs and subjects regarding science and sort of vehicles and spaceships and things like that. So whenever these subjects used to come up randomly in other things that I used to read, I used to get very interested and kind of read more about them. And the more I used to read about them, I used to get completely involved. And then, that hyper concentration or so-called hyper focus, also a trait of autism spectrum, that allowed me to block the sensory input and the sort of the hustle bustle of the environment allowed me to concentrate and then kind of, spend more time with those subjects as opposed to dealing with people or socializing or interaction with the people around me. And that led to greater increase of learning on my own and also allowing me to kind of, share that information, because as soon as you learn, you then want to talk to others about it. You want to talk about those subjects. I became sort of a subject expert at a very young age on certain subjects, right? And that, again, is another hallmark of the autism spectrum of disorder. So this is all connected to the symptoms of ASD. In fact, Hans Asperger, the one who defined Asperger syndrome, he called such people little professors because they generally are inclined towards teaching roles or areas
Yeah.
where they specialize at a very young age because of their obsessive interest in particular subjects.
Ah, I see. I see. It's very informative. And so for the, now there's a little more awareness kind of coming around to in this age. I realized there's a character on Sesame Street that was introduced called Julia, and Julia has autism spectrum. She's on the autism spectrum of disorders, and I'm wondering what your experiences with friends and in your social emotional kind of experiences were when you were growing up, considering that there wasn't as much awareness earlier and people didn't know much about it. What was it like for you in terms of your social life, in terms of your social emotional development as well?
Well, I guess I've been blessed to have a large family, so I didn't have friends per se. My only friends really were my cousins or relatives that used to come over and spend a few days on there. Other than that, the concept of friends is pretty much alien when I was growing up, right? And so, as far as the socialization goes, I didn't really like a very noisy environment, so I used to avoid groups of large gatherings of people and kind of play on my own or alone or kind of in a quiet environment. But that actually allowed me to read. And then when I got bored from reading, because there weren't any enough books, I just used to go through them very fast. I used to just see whatever's on television or, kind of learn from Sesame Street or other TV programs that used to come, visually. They were very exciting, very interesting programs that used to come on television. So I actually was learning above my sort of grade or age level because that content was actually meant for slightly older children, right? And so that allowed me to visually kind of learn quite a lot and but on my own, and the social integration wasn't there as such. I had probably obsessive interest, as I said, in certain subjects like particular toys or things, and or Lego perhaps when I was growing up, definitely. So I used to kind of engage with other children through that content, right? Through the toys, as in sharing what I am playing or kind of working in solitude, but on different kind of Lego blocks and not really talking, but just kind of playing. But it looks like we're playing together, but actually we were playing on our own. So that kind of engagement with our children was not very communicative, but more visual rather.
Right,
You know,
right,
yeah.
right. I understand. And I feel like as you grow up, and as other people around you, the neurotypical individuals, they grow up as well. Having a little professor around you as a friend would be actually quite fantastic because they get to learn so much as well. So I imagine it becomes, I could be wrong, but it becomes slightly easier to engage and interact with individuals anyways um, as you grow older. And typical individuals kind of develop that sense of understanding and wanting to learn as well.
Yes.
So I mean, like, I want to talk a little bit about what sort of awareness has also come around in terms of persons with disabilities. And I know this phrase is used very often because it is coming from the United Nations. And I'd like to hear your thoughts around the terminology, the usage of appropriate language. What is your take on how important it is and how much words matter um, to you in specific and in general to perhaps the engagement between neurotypical and individuals with disabilities?
Right. So basically, what has happened in the past, particularly, is that the terminology has actually changed. It used to be just disability, really, and now the word that everyone is using is called um, neurodiversity, right? And and from the masses or other people being neurotypical, to the people with special needs per se being called the being unique and being like a neuro minority
Mm.
among
Mm.
society generally, and all the so-called differences, if you call them, let's say ADHD or these so-called labels. The Western world is moving towards a model of inclusion in which first it starts with acceptance, like let them accept, and then and with respect, of course, of such people, and then their choice. If they seek out help, then you help them. Not forcing them in certain area, or to behave differently or to behave like neurotypical people. And then that has led to the word of, I think it's called identity first language. So in the past, people used to say a person with autism, right? That was the common terminology. Even the UN was referring to that terminology generally. But now these so-called self-advocates or people on the spectrum, they actually sometimes prefer to say, instead of a person with autism, they would say an autistic person,
Mm-hmm.
right? So that person first language kind of puts them first and the condition as part of them, as
Right.
opposed to someone, let's say, having a disability or a disease or something bad, sort of a label attached to them. That's a lifelong condition, right? And
Right.
it doesn't go away. Even as though you are accommodated, it'll never go away. It'll
Right.
just kind of, visually kind of not interfere with other people because it won't be disruptive anymore, because you've been accommodated and you kind of function better in society, and but it won't go away ever. It's just
Yeah.
hidden.
Of course. Of course.
So the language has changed a lot, and that has caused all kinds of confusions, particularly in developing countries, because here you have the vocal parents are actually the parents of the non-verbal, or the children who need a lot of more support, so-called on the lower end of the spectrum. It's them really, and those people basically have been leading the movements, the awareness movements, the advocacy movements, and so adults on the neurodiverse spectrum, I identify as one, but I'm just saying, where are the others, right? As
Yeah.
in, why am I so-called the first or second person that I probably met like myself in the last, let's say, 15 years in Pakistan, right? Where are
Yeah.
the other South Asian self-advocates? I don't see them at
Right.
conferences that I've been to, right? I was the only one there. And so either they don't want to be coming forward, they don't want to talk about it because of, I don't know, maybe it's a taboo subject in their societies, perhaps. But this sort of acceptance and encouraging people to be self-advocates, this is very new for South Asia, and it
Mm.
needs a lot more people coming forward. We need critical
Sure.
mass, and a lot more work has to be done. One person can do only so much, right?
Of course.
As opposed to 10 or 20 or 30 people. Look at the West. All this change was brought about by self-advocates coming forward in large numbers.
Absolutely.
They are the ones who are pushing forward for change, and people are listening to them.
Absolutely. Who better than themselves, of course. But for you as well, Fazli, because I do understand that some people also refer to themselves as, so a lot of blind people say, I call me a blind person, as opposed to a person who has blindness or has a visual impairment. And then there's individuals who are deaf who refer to themselves as the deaf community and call themselves deaf. So I wonder if these individuals, like you mentioned, somebody saying something like, I'm an autistic person, as opposed to a person on the autism spectrum. It's
Or
almost like reclaiming
a person with autism.
a person with autism.
That's
Uh,
the
so you
really
want
important.
for you to specifically, but I also understand some communities within the disability ambit are kind of reclaiming their disability and calling themselves a deaf person as opposed to a person with a hearing impairment.
Yes.
So I wonder what it's like for you. What is it that you would like to be referred to as if people were talking about you? I mean, for sure by your name, but
I think the confusion and the complication that happens is, as I said, I am one person who is a self-advocate. I actually know another one, who lives in Karachi, and he's studying right now, Ahmad Siddiqui,
yeah,
and
of course.
he's also a self-advocate. I would say the second one really. It's
Mm-hmm.
come forward, for Pakistan, so proud of that. But other than that, I don't know anyone else who's a self-advocate for autism, right? So you can't really define a language on the basis of two people's voices.
Sure.
We need there's a whole community, but it's kind of hidden. It's a hidden community. there are people who, for many reasons or reasons of their own, they don't want to come forward. And that's where the problem starts, because you can't advocate for change unless you hit critical mass. You need large numbers of people. Parents are not enough. Doctors, pediatricians are not enough. You need the self-advocates to come forward, right? And
Agreed.
that's where real change can happen and has happened in the West.
Agreed. Agreed. No, 100%. That makes a lot of sense. Um, I also realized we might have to come to a close. So right before we conclude, just want to ask you as to if there's anything in specific that you would like to share, because I know that it is important for people, like you said, to step up, to talk about it, for it to be something that isn't, because the lack of communication is only a hindrance to anything and any form of change that might or could potentially come around. And it's a slow process too. I've been working in the disability inclusion sector for 8 years now, and I know that there has been change. I can feel it, but it's been slow. So what is it that you would like to share with the audiences watching, or hearing or listening in specific, a type of message that you want to send out, any form of experience that you want to share? I just want to hand over to you to do so.
Right. So for people who are going to apply, because I am a Fulbright alum, very proud of that, and thank you to the Fulbright Commission for choosing me to go on a scholarship. I would recommend for people who have any kind of impairment, disability, differences, please apply for the scholarship. I took that plunge, and I don't regret it. I'm very happy that I did, going out to my comfort zone and to go for a scholarship to a country living abroad for such a long time, which I'd never done before. So yes, please do apply, and your differences will be respected and your uniqueness will be celebrated. So that's one for people who want to apply for Fulbright, and they believe that they are neurodiverse or different or and so on and need accommodation. So Fulbright is very accommodating. Second thing is for parents out there, yes, you can advocate for your child, but wouldn't it be better if your child advocates for themselves? So, from a young age, train them and make them aware that it's okay to be unique, different. You're not alone. There are other people out there. Reach out to them. They'll help you. I've emailed so many people across the world, and I've received so many replies and advice. And, it's people, you're not alone. So that's, I guess, the important message. Never think so. It doesn't matter what your society kind of has an opinion. The whole world is open. We are the human race, right? There's so many people out there like you and parents like you, and I'm sure, so they'll be able, they want to help you. Reach out to them. I'm sure people will give you good advice out there. I also want to give a message out to perhaps employers. Look, if you employ people who are neurodiverse, there are so many corporations like Microsoft and others, SAP and so on. They have entire programs that just hire people who are different or neurodiverse. And these employees actually not only perform and are accommodated, they perform better than so-called neurotypical employees in particular subjects and areas such as IT related or computer science related. I know it's a cliche of that whole, you see those videos of the Rain Man, the movie that came out in the 80s of Tom Cruise and Dustin Hoffman with that sort of savant level intelligence. It's a cliche, but if you accommodate a person who's different, those differences will help increase the diversity of your workforce as well as the productive output of your company, because it will give your product a unique voice, a unique opinion. That uniqueness has to be celebrated. It is human differences, and these differences are the ones that make us innovate. They help us push things forward. They help us create solutions for us and for future generations. So these kind of sort of three groups of people are those that I believe this message can or should reach out to.
Absolutely. Very well said. I mean, celebrating differences and making the world a little more inclusive. Thank you for joining us, Fazli. Such a pleasure always speaking with you. And thank you for enlightening our audiences with your thoughts, your experiences.